Hey there, everyone. Chapter 5 should be up on your screen right now. Chapter 5 is a pretty short PowerPoint lecture, but it is a pretty important chapter. In fact, this chapter is one that will kind of follow you throughout the rest of your medical career, whether it's in EMS or nursing or whatever you're choosing to do with your medical career. Medical terminology is one that it's kind of an interesting subject in a way. It plays a really big role when we are learning about medicine or talking to other medical professionals, but it's one that we really shouldn't be using any sort of medical terms when we're talking to patients or family members. And if you do, say you say something like you've got tachypnea, you should follow that up with an explanation as to what in the world tachypnea is, right? Which is fast breathing. In my experience, the farther you get along in your medical education, so EMT, advanced EMT, paramedic, nursing, doctor, whatever you are choosing to do, the less likely you are to be good at explaining things in simple terms. That's my personal experience with it. I mentioned in a previous video, my dad has a lot of heart problems. So dealing with cardiac surgeons in Rochester, you almost need to, have them speak into a Google Translate to understand exactly what they're saying, right? And that's no hate to them. They are absolutely amazing surgeons, but they aren't always great at explaining what in the world they are talking about, right? So I strongly recommend, especially for those that are planning on going into more advanced medical situations like hospitals, etc., don't ever lose your ability to talk to patients like people as opposed to talking to them like medical professionals. That sounded weird. Not to say that medical professionals aren't people, right? But talking to them in plain English versus medical jargon, right? Because it can be confusing to hear all of those complex terms, right? Yeah. So kind of starting off with anatomy and physiology. Anatomy is the study of body structure, whereas physiology is the study of body function. But both help us gain kind of a better understanding of what in the world is going on with the body. And using medical terms to describe anatomy and physiology can really help clear things up. So anatomical terms. Anatomic position is a position that we are always that we're kind of assuming our patient is in. If our patient is in anatomic position, the right side of the patient is always in the same place, if that makes sense. So anatomical position is facing forward, hands at the sides, palms facing forward. Midline divides the body into planes. We've got the medial, which is going to be closer to the middle, and the lateral, which is farther from the midline. So this is where that anatomical position comes into play. For instance, if I were to say that the injury is lateral to the elbow or whatever, right? That's going to be farther away from the elbow. It's kind of a weird way of putting it, but you get the idea. That's only if it's in like anatomical position, right? Hands down to the side. If your arm is up and across your shoulder, it kind of changes the positioning of where that injury is, right? So we're always going to go off of this anatomical position, regardless of whatever position the patient was actually in. Bilateral refers to both sides. So if we have bilateral ear infections, it means we have ear infections in both ears. Unilateral is one side. So this isn't a term we use a ton. If it's only one side, we'll say left or right. Mid-axillary line, this runs down the middle of the armpit on the lateral side of the body. So if you lift up an arm, put your opposite hand in your armpit, and then draw a line straight down, that's your mid-axillary line. Axillary refers to the armpit. We also have some directional terms. So anterior is going to be the front of the body. Posterior is the back of the body. Superior is going to be above, inferior is going to be below. So if I were to say they've got an injury superior to the vena cava, that would be above the vena cava, so probably in the neck area, something like that. We have proximal, which is going to be closer to the torso, distal, which is farther away from the torso. Palmar refers to the hand, so think palm, palm of your hand, and plantar is the sole of your foot. And then, of course, we've got all of the terms for the body as well, right? So pelvis, knee, thigh, legs, etc. My best advice for all of this, and it's kind of crappy advice, but my best advice for this is just straight memorization to begin with. It will make things further on in the course a lot easier. If I say, hey, lay supine, you know what position that is, or lay prone, you know what position that is, right? So a lot of this is just going to be straight memorization to start with, but it does make things a lot easier, especially when it comes to dissecting bigger medical words. You can really figure out what it's talking about when you know prefixes and suffixes. So midline of the body, here we've got that midline straight down the center of the body. And this is a good example of the anatomical position here. Proximal is going to be closer to the root of the limb, so closer to the shoulder. Distal is farther away. Left and right, of course. Mid-clavicular is if you take your collarbone, cut that collarbone in half, and then go straight down. That is your mid-clavicular line. That becomes important when we start placing EKG leads. Medial is towards the middle, lateral is towards the outside. Dorsal is going to be the bottom or posterior area, and then ventral is going to be the anterior front portion. We also have different planes. This is something that becomes incredibly important when we start looking at organ placement or medical imaging. Not something we use a ton of in EMS. It is important to have a general idea of what we're talking about. You will be tested on it, but we don't use this as much as we use general, directional terms. So the frontal plane is if we cut the body into front and back halves. So if we're looking at, say, a CT scanner and we're looking at the frontal plane of the imaging, we're going from the front, cutting the body in half all the way to the back. So imagine like the first image might just be the tip of the nose. Second image might be nose, lips, abdomen, toes, right? And it'll continue to go backwards. The sagittal plane cuts the patient in half on that medial line. So from, into left and right half. So if we were, again, looking at a CT image, you can kind of see if we're going on the right side, it would start with your right fingers and then your hand and wrist all the way up to your shoulder, and then you'll start to see the rest of the body as it kind of goes through. And then transverse plane is going to be the horizontal plane. It goes from top to bottom. So again, if we're looking at that image, it would start with, say, the head, the very top of the head, go down through the brain, through the face, into the neck, so on and so forth, all the way down to the feet. So again, not something we use a lot of, but it is important. Abdominal quadrants, this is incredibly important when it comes to determining what is causing the patient pain. Right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. And it's divided by the umbilicus or the umbilical cord or belly button. So you can see here on the abdomen, we've got the line going straight through, crossing at the umbilicus, and then divided into those sections. The diaphragm is kind of the upper boundary of the abdominal cavity. Supine refers to laying on your back, so supine on your spine. Prone is laying on the patient's abdomen, and then recovery position is in that left side, preferably the left side. Anytime we've got a patient that's unresponsive, laying them on their left side is a little helpful as far as controlling their airway, getting suctioning in place. We never want to have a patient transported prone. We see that every once in a while, it'll pop up in the news where a patient was transported prone and they ended up dying from positional asphyxiation. So we never want to transport them prone. Oftentimes when we are documenting a patient was laying prone, it's referring to when we first got there. When we first got on scene, they were found laying in the prone position. So supine, prone, lateral recumbent position. Fowler is sitting straight up and down with their feet out in front of them. So if you were laying in bed, sitting up, that would be a Fowler position. If you're laying slightly back, kind of in a probably what you're more likely to look like when you're laying in bed, that would be a semi-Fowler position. So this would be a semi-Fowler position here. Yeah, that was actually the end of this chapter. As always, there is the chapter review. That sounded really Midwestern. The chapter review at the end of it. Feel free to review that in your own PowerPoint slides. Those will be located on Schoology.